This is special COVID-19 coverage on Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal.
Well, as the days go by, they all may seem the same for most, but within the healthcare system, each day presents new challenges, new hurdles, and new concerns. And one of the concerns as of late is staffing. Hello, and welcome inside the Your Health podcast. I'm your host, Shaun McMahon, reminding you to check us out on all your favorite podcast platforms and at CIUSSWestCentral.ca/podcast. That's CIUSSWestCentral.ca/podcast. And a special thanks to all of our new subscribers. It's great to have you along with us. Over the last few days, there's been a heartfelt appeal from the provincial government. There is a dire need to hire more people within the system just to provide additional support for frontline staff in long-term care facilities and everything else in between. And CIUSSS West Central Montreal is no exception in order to face the steady weight of this pandemic. Maybe you've got the will, maybe you have the expertise, maybe you have the time, or maybe you've got all of the above. Either way, you probably also have lots of questions. So let's turn to Maria Monaco to get some of those answers. She's our latest guest on the Your Health podcast. Hello, Maria.
Hi, Shaun.
It's nice to have you with us. Maria is the Chief of Talent Acquisition and Staffing at CIUSSS West Central Montreal. Interesting times, right, Maria? Talk to us about what you need. What positions are you looking to fill at which facilities, and what types of skills might be required?
Sure. Thank you. First, I want to start by saying thank you so much, Shaun, for having me on today.
Oh, it's a pleasure.
As many of you are following the news and the media, there's a dire need of help out there for more for the CHSLVs, for the long-term homes. We need help. Any type of help is so welcome, from PADs, nurses, housekeeping attendants to help us clean the rooms, admin support to help us with some of the administrative work. But more than anything, what we need right now is people to come in and help us with the elderly, help feed them, help keep them company, talk to them, help move them a little bit. That's really, really what we're looking for out there. So the skills, honestly, in regards to helping out, it's open to everyone. It's open to anyone who feels, they're compelled to come and help. This is your way to contribute. This is your way to help. And it's, quite simple.
Now, Maria, let me ask you, because I'm curious what happens when this pandemic eventually comes to an end. Are you hoping to keep the new hires on as permanent employees? How does that work?
Absolutely, Shaun. It doesn't stop here. And obviously, right now, we're really working to fill for the pandemic. And so we need lots of hands and lots of help. But after the pandemic, there still will be lots of needs out there. And we still, like Legault says every day, there was a shortage prior to the pandemic. So there's opportunity for these people that are coming in on board now, and especially some of the skilled frontline help, to fall onto positions after the pandemic. And also for the ones that are helping, there still will be need for help afterwards. So absolutely, this is continuous.
What about incentives? Can I ask you about that? Because I want to know if there's anything that makes this more appealing to encourage folks to get on board right now.
So it went public not too long ago where most of the frontline help, so most of the people that are going to be working in the nursing role or in the PAB or what we call the licensed nurse practitioner, the LPN, a lot of these frontliners are now, the ministry has attached an 8% incentive in some areas, in very specific areas. And in others, and for other titles that are out there, the ministry has attached a 4% incentive. So yes, there's an interesting incentive out there to get the people to come on board, and while helping and while caring, we'll make some extra money as well.
Exactly. So the incentive is there, which is nice. But let me put myself in the position of somebody who's interested. The question that immediately comes to mind, I think, is how safe is it for me to come and work there right now?
Yeah, and I completely understand, and it's something I would personally ask. And honestly, it's safe. They are treating everyone that is coming in on contract, I'll call it, entre guillemets, or coming in to help as though they're an employee. They are getting all the same equipment. They are receiving all the same protective equipment. They are going to be briefed and trained before actually going out there and assisting. So everything is there to make sure they are safe coming in to help, and that the elderly and the recipient, the patients, are also safe. receiving the help from from the public.
Maria, listen, this is, as I said, an exceptional time that we're living through. You've probably, I would imagine, interviewed and onboarded hundreds of employees, if not more,
yes.
in your time.
Yes.
What would you like to say to people who might be maybe on the fence about what to do right now, about, how important this request is? Because that's what it is.
Yeah.
It's a request to come and help those who need it most.
Absolutely, Shaun. What I want to say is don't be afraid. Come on board, come and give us a helping hand. It's such a privilege, actually, to be in this position right now to come and help. And people who feel compelled and are graciously wanting to give their time and be a part of this and be the positive part of this. Don't be afraid. Come on in. We will take care of you. We will give you what you need to be safe and to feel safe, to deliver the care. And we'll take care of you just as we take care of our employees, and that we take care of our people, our elder and our patients.
So important. Lastly, Maria, is there a phone number or a website that people can call or consult if they have questions or just want some more info?
Absolutely. So we have a number that it's our cell number. We have it on at all times. We promise if we don't answer right away, we get back to you within the hour. So it's 514-293-0526.
Okay, again, that's 514-293-0526. And there's a website too?
Yeah, absolutely. Design Your Career.
Okay, so that's designyourcareer.ca.
Yep, Design Your Career, and in French, Dessine ta carrière.
All right, there you go. Check it out. What a great opportunity to help the community at a time when people need it so badly. Maria Monaco, Chief of Talent Acquisition and Staffing for CIUSSS West Central Montreal. Thanks for doing this. I hope you get a lot of phone calls.
It was a great pleasure. Thank you so much, Shaun, for having me.
You've been listening to special COVID-19 coverage on Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal. Don't forget to subscribe at CIUSSWestCentral.ca/podcast or on your favorite podcast platform.